Want to be sure you're getting the most out of your retirement for all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now here's Jim with this week's Dollars and Cents tip.
This week, since we're talking about healthcare, I want to talk about the healthcare power of attorney and the living will. The medical power of attorney, of course, is where you're appointing somebody to make your medical decisions for you when you cannot. There's also a financial power of attorney. Those are two distinctly different powers. Many attorneys put those all in one document. Most either separate them in the document or do two separate documents. So the medical power of attorney is specifically for your medical decisions. And probably the number one mistake that I see people make is where you name your spouse, for example, as your power of attorney and you don't have a fallback. You don't have a contingency. And what if your spouse cannot serve in that capacity? So be sure you name a fallback. Also, I think it is cleaner for the fallback if you have multiple children, is that you don't name them all and say the word "and" in there, because what if they disagree on the medical treatment? It's better to name one, then the next, then the next. So, and if one of them needs to remove themselves, they're not, in a place where they can, maybe they're traveling or who knows, but if they're not at a place where they can really be involved in that process, they can just step out of line and it goes to the next child. But it's really cleaner, at least based on the attorneys that I talk to. Of course, I'm not an attorney, but the attorneys that I talk to, it's cleaner usually to just name one child, then the next, that kind of thing. Now, the living will is simply an advance medical directive. And the most common document in Tennessee is called the Advance Care Document. It was put out in the state of Tennessee. I think it was back in 2004. You don't have to use the Tennessee Advance Care. Many attorneys use their language even if they put it on their own form. One of the advantages is the hospitals see that document all the time. If you have any other kind of document for that, it's not that it wouldn't work or be legal. It just, it could create questions with the administrative staff at the hospital. So my stance on that is to make it as clean as possible. Now, if you have a medical power of attorney, you really don't have to have a living will. Your power of attorney can make those decisions. I think especially for those that are at retirement age, the clean thing about a living will is you're taking the weight of the decision off of your loved ones. And a living will is basically a death with dignity document. You're incapacitated. You have no hope for recovery. Death with dignity. You're making those decisions, and you have the legal right to make those decisions for yourself. It takes that burden of that decision off of the shoulders of your child. So that is one of the advantages of a living will. Even if your child knows what you want, if you've put it in writing, all they're doing is executing your wishes.
And that's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting BroganFinancial.com.